Hi, I'm Dr. Rizwan. I'm a registered pharmacist from Punjab Pharmacy Council, and I am working as clinical and oncology pharmacist at FAROOQ Teaching Hospital, EXPRESSWAY, MURREE, affiliated with Akhtar Said Medical College. I'm graduated from Punch University, Rawalpindi, Azad Kashmir, and I am the resident of Kodli, Azad Kashmir. As a clinical pharmacist, my job responsibility are to promote the rational therapy and to manage the patient safety about the medication regimen. Different wards I have to make the rotation in different wards to manage and to optimize the patient medication therapy, and also monitor drug interaction, drug disease interaction by communicating to the consultant. And if a patient receiving the medication that have drug interaction, my duty is to communicate with consultant and change the medications to optimize the safety of patient and its outcome. Also, it's my duty to communicate the patient and consult about the medication usage, the proper way how to administer the medicine. Also, conduct the training program of pharmacy students, also the nursing staff, and develop and the guidelines about medication administration and medicines protocols, safety of medicines. The most important thing that is the maintenance of cold chain, how to maintain the cold chain for the medicines that have the temperature range from 2 to 8 Celsius, because if we change the temperature range from 2 Celsius and above 8 Celsius, the efficacy of fridge item will be lost, and this is a very important factor you don't have to neglect it. Also, as an oncology pharmacist in the FAROOQ Teaching Hospital, we are treating two types of patient, leukemia patient and lymphoma patient on Sehat Sahulat program. My duty is to calculate the exact dosage according to BSA, body surface area of the patient, also counseling of patient, and also the guidance the staff about medication administration, and also preparing the chemotherapy according to guidelines. These all are my job responsibility. And also in the PEDS ward, I have to calculate the dosage of the PEDS patient according to body weight to optimize the therapy and minimize the adverse effect. Also, I have to monitor adverse drug reaction, pharmacovigilance, monitor the safety of patient when patient is administering medication, and if any adverse drug reaction occur, I have reported it to pharmacovigilance adverse drug reaction form, putting all the detail about the medicines to ensure that medication safety will be optimized, and the error of the adverse drug reaction will be reduced. Thanks.